Thompson. I'm an occupational health nurse. I work here at the MFL Occupational Health Center. And today we're going to cover a fairly big topic in about 90 minutes, plus a half-hour question and answer session on implementing workplace COVID-19 safety plans and minding your gaps, or understanding what your gaps are. I think we've been in this now for better part of a year. And I think the real concern in the health and safety community is understanding what we're doing well and what we could improve on. So we're going to cover a lot of topics, and I'm just going to get right into it. So we'll let people come in as they arrive. Here at the OHC, we like to start with a land acknowledgement. We'd like to begin by acknowledging that we are on Treaty 1 territory, the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. We respect the treaties that were made on these territories, and we acknowledge that we are all treaty people. At the OHC, we commit ourselves to a process of reconciliation with Indigenous communities. I want to just pause for a moment. I know sometimes this land acknowledgement becomes kind of a due diligence exercise, and then we move right into housekeeping and next steps. I just want to pause though and say I think for me right now, reconciliation, of course, it's a deep, complex, powerful word. But for me right now, it's really listening. It's taking a moment to reflect on how everyone, particularly folks from communities that are suffering now more than they might otherwise due to the COVID-19 pandemic. So coming from a community health center, we really value health equity. We value understanding where folks are coming from and meeting them where they most need to be met. So I think for me right now, the theme is listening to our communities and not being an expert to the point of knowing everything, but being willing to listen and reflect. So I just want us to kind of cling to that idea as we go forward today. So this is just a little bit of like I said, some housekeeping on how we're going to run this. I guess I'm the host. I'll be running some polling questions, and Tiffany Powell, our resource coordinator, is going to be in the background. She's going to be taking questions through the chat box. I'm not going to be looking at the chat box. It's always tricky as a presenter to try and juggle too many things. So thanks, Tiffany, for doing that. She's going to compile the questions, and then once we've reached the 90-minute mark and we enter the Q&A, she's going to pull up a Google document, and I think I'll lose my screen. She'll take over, and hopefully we'll answer some questions that you've been accumulating. If something I don't cover, or if you disagree with something, that's okay. We'd love to hear from you. We're not going to be able to get through the world in 90 minutes, so having a follow-up or having certainly a request for information or something a little more deep, that's what we're here for. So that's a big part of what the OHC does. This session is going to be recorded. Hopefully it's being recorded right now. And it probably will be posted to our website, or you can look for a link that can also be sent out. This, once again, besides the polling questions, I'm going to be toggling through a number of tools, documents, and web pages. So bear with me as I get my hands on some of this. Hopefully it'll work out fine. Okay. So this is the first question. And like I said, I can't promise you we're going to cover every possible gap, but I am curious what folks are finding. So what gaps or difficulties have you noticed in your COVID-19 safety planning and or the implementation? So I have the questions on the screen here, and then I'm going to pop up the polling question. So here we go. Logistical and resourcing problems. So maybe that's cleaning, equipment, scheduling, something that might have some more monetary or time limited sorts of features. Lack of training and or awareness around COVID-19 hazards. We know COVID is changing, or at least our understanding of it, so making sure everyone's on the same page. Remote work, and returning to work or returning to the office as the lockdown hopefully lightens up here in the not too distant future. I know that's going to be a concern. And then mental health and psychosocial concerns, fear, anxiety, management being concerned about low productivity and kind of the impacts on people, morale, things of that nature. Also challenges to change management. Maybe things just aren't quite sticking the way you expected them to. So that's also a really big topic. And then the last one here is, there's more. Obviously, there's more, but these are the 5 that I've been kind of coming across. And so if this doesn't ring true to you as far as a priority or a gap, that's okay. You can mark the last one here and save it for the Q&A. So I just have to get my cursor here. We're going to go to the poll. Poll number 1, perceived gaps. So just take a minute. Here we go. So you should see all of those choices. I shortened them for you. I'd love to know, it will impact a little bit how I continue with the presentation. I can kind of shift my priorities just a little bit. And just to let you know how the polling is going to work. And for those of you who are listening on the recording, that's why I put the questions and the answers, or at least the choices on the screen, on the slide, so you can at least see all of that. You won't be able to see the pop-up window for the polling, but those of you in real time are going to be able to see that. And I like to cut it off when I reach about 80%. So right now we're about 70. We'll just wait. Usually people are pretty quick. I appreciate folks, being as quick as possible. Webinars are limiting, but at least we have some way to kind of talk to each other this way. Okay, interesting. All right, so I'm going to end the poll. I'm going to share the results. Looks like we have a bit of a bell curve here in the middle with regard to handling remote work or returning to the office, and then mental health and psychosocial concerns. Those 2 are neck and neck. All right, so that's actually really helpful information to know. I did do a session on remote work back in early December, so there might be some repeat customers here today, in which case that's great. I want to do some other longer or kind of maybe a half-day session on some of this material. So all of this is very, very informative for me. So thank you. I'm going to stop sharing that. We're definitely going to be covering mental health and some psychosocial concerns in the latter third or so of this presentation. So I'm going to close that window. We're going to move on here. So what we're going to cover, all right, getting a grip. I'm going to just very quickly give you a current update. I'm sure you might be as glued to the news as I am these days with current events going on in Manitoba and elsewhere around the world with regard to the pandemic. So I'm going to talk specifically kind of where we're at in Manitoba. I think it's really important to have a grounding. I maybe did this in some other presentations, so if you're getting a repeat dose of this, I guess maybe I shouldn't apologize, because to me, it's really important to understand the ethics for why some decisions have been made, perhaps at the government level, but then also within your organization. And I think folks in health and safety I think it's important for us to understand there are rationales and reasons for why certain decisions are made, and that is bound in different principles and different ethics. So I'm going to definitely cover that. And then we're going to review some safety planning and implementation kind of best practice, just as a refresher. And then we're going to go right into some tips, tools. I've got a number of websites and resources that I would recommend. And then some of the big guns here as far as concerns. I know these viral variants have people nervous, and I'm nervous too. So we're going to cover that. Aerosolized viral transmission and how ventilation is another missing gap in a lot of workplaces. And then, of course, we're going to end on psychosocial factors, particularly psychological health and safety, but really creating environments where people can safely express what their concerns are around anything, really, not just COVID. And then we'll have the Q&A. So we got a lot to cover, and let's just keep going. So it is now 2021. We've been in this now first cases, at least in the States, were in January. I'm not sure what it was in Canada. I just know that basically it's been a year. And we know more now than we did a year ago, for sure. There were certain missteps. I don't want to rehash tons of the past, but what we know now, what's interesting about the coronavirus is it's like it will be the most researched bug of its nature in all of history. So that's both a positive and also a unfortunate thing in terms of actually implementing some of the good science and evidence that has come out. So we are learning, and every jurisdiction is different. I know Manitoba, not to get too far into the politics behind this, because it is in the end political, right? Public health can and does become political because of the nature of it. I like to bring, so this is the dashboard if you went to the government website to look at kind of where we're at with COVID. And you may think, okay, well, 813 deaths out of what, 1 point something million folks living in this province doesn't seem like a lot. ICU beds, okay, that's not a lot, right? I mean, even our positivity rate, yes, anything over 5 is not great, but it is coming down a little bit. So you may be thinking, okay, we're doing good, and we are. I think that the lockdown, fortunately, we're starting to see kind of a flattening. But I still think over the holiday, there's definitely some bumps. So it was 9.9 the other day, we're down to 9.6. And what the test positivity rate means, of course, is just the rate of, I'm not going to get into the specifics of exactly those ratios, except to say that it's what percentage of tests performed come back positive. And, certain corners of the world, it can be 20-25%, which is just out of control. And here we are bringing it down. Just remember that it's not really about, as tragic as every illness and certainly every death is a tragedy. What we're really concerned about is healthcare utilization and the burden on the rest of the healthcare system. Because just remember, I mean, there's normal things, right? Heart attacks, strokes, other kind of complications from chronic illnesses and things that put people in the emergency room. So all of that is being affected by COVID. And so I think the general public needs to remember that, yeah, these numbers may not look like they do in other parts of Canada or certainly in the US. It's absolutely critical that we think about this from a healthcare utilization standpoint. And the ICU bed is a big indicator. So here's my next question. Okay, so what is the most important asset we possess to successfully beat COVID-19? All right, so here are your choices. 4 of them. An affordable, readily available vaccine, clear leadership and open communication from decision makers at all levels, a sense of shared purpose and trust between all members of society, or all of the above are equally important. Okay, so let's do our polling. I'd be really curious to see what people say. Remember, it's most important, so you have to pick one. Or I guess if you pick D, you just say they're all the same. Okay, so we're at about 82%. So for the purpose of time, I'm going to end the polling. So here we go. All right, I have 70% of you, let's see, I have to share the results, sorry about that. 70% of you said you thought they were all equally important. Okay, they are all important. I didn't mean to trick you up with certain modifiers and adjectives here, but I was looking for actually the third choice, C, a shared sense of purpose and trust between all members of society. When you're dealing with a public health crisis, that truly is the most important feature or countermeasure you have against something like COVID or SARS-CoV-2. And that is because all of the other elements, right? The vaccine, good communication, good leadership, all of that is contingent on folks listening and trusting that the authorities and that the scientists and that the people who develop and distribute the vaccine are seen in good faith. So I would argue that C really is the most important bedrock thing that we need. The rest of it is important. I don't mean to diminish that. It's a very close neck and neck, but we got to have what's called social solidarity. And that is what my next slide is about. So social solidarity, here's a definition, is the cohesion between individuals in a society that ensures social order and stability. It underlines the interdependence between people in a society, which makes them feel that they can improve the lives of others. So this was a gentleman, Durkheim, back in 1933. Okay, 1933 would have been about when, you know, the New Deal came about, at least in the States, with regard to Great Depression, thinking about, we're in this crisis, how do we claw ourselves out of it? And why is it so important? It really is this key linkage. And I bring this up, I know I promise I'm going to get into more of the nuts and bolts of health and safety planning, but I really think these concepts are really important to ground ourselves. It ensures social order and trust and stability. We already know that the coronavirus has created kind of a cesspool of misinformation and mistrust in the world, and that some people think this is just, you know, a bad flu season or something. It is not. And when we get into more discussions around transmission and the variants and things, I'm hoping maybe we'll convince folks that this is not a normal thing, although pandemics are quite normal, as much as we don't think about them very much. But what I like about social solidarity is it brings about this idea that we can care for the underprivileged, that we have enough for ourselves and we have enough to support others. And it allows for, it actually allows for the possibility of being socially distant, right? Imagine if we had high levels of mistrust in a society and then you were forced into this, you know, lockdown, social distance situation that we're in. How long do you think that society could persist if you didn't have some bonds, some trust, and some mutual understanding that was already there to begin with? So there's a difference between social distance, which would be kind of based more around socioeconomic differences or social determinants, or by class or race or ethnic background, versus social distancing, which is a public health measure. So social distancing, or I should say social solidarity, allows for the distancing to be possible, and ironically can actually promote social solidarity if you know, you do need to have the leadership to back that up. And the reverse is true, right? It'll make things worse, right? And we live in an age of high inequality, certainly from an income standpoint, but so many other determinants of health are also undermined, certainly by the pandemic, but by situations that existed before. And if you look across Winnipeg, for example, there's huge differences in mortality rates. You know, like some studies have shown like an 18-year difference from the north end to the south end as far as life mortality rates. And, you know, globally, we're not doing a good job at this. You know, some countries are better than others, but we're not recognizing this importance that we're in this all together, and that you need to have, along with the science and along with the countermeasures that are things like vaccines and PPE and the things of that nature. We need to be promoting more of that solidarity, and that happens with, like I said earlier, with listening. And it really is the #1 public health countermeasure. So I want us to think, I know it sounds a little bit like, you know, kumbaya kind of mentality, but it really isn't. And societies have this, we all have it. We wouldn't be a democracy that's functioning if we didn't have this already. So I wanted to find public health because I think in health and safety, I have a master's in public health. I come from that background, that my training as a nurse and as a program planner and developer, like that's what I did before I joined OHC and before I did community health. But what it is it's not like, we are part of public health. Occupational health and safety fits under this broader umbrella. And it is, it is what we as a society collectively decide what are the conditions people are going to live in. Like what is going to be our version of health. And so it's a choice as a society. And then of course there's a science, but it's also an art. And like I said, it is political. Anything involving the public will be political, and that is to be human, right? So politics have their place. We can't fight the fact that it's going to happen. But health education, promotion, research, disease, preventing disease and injury, that is at the heart of what public health is. So when you think about the ethics, okay, when you think about kind of, like I said, the choices you make as a society, as far as how do we prioritize certain activities and budgets and things of that nature, you can think about they've from what I've read, there's usually 4 kind of silos you can think about. I mean, there is a bit of a spectrum here, but if you think kind of from left to right, left being kind of not as ideal or as comprehensive, and as you move to the right towards prevention, you see a more nuanced, but also a more targeted and sustainable way of thinking about prevention. So the gambler's principle, I have to say that I used to have a little photo of Trump with bars across his eyes when I put this slide up. Realized that's a bit triggering, so I pulled that out, especially given current events. And I'm also I'm an American and an immigrant myself, and so it's funny because I still feel like, well, it's my right to criticize my own government, even if it's down there, and I'm very happily settled here in Canada. And all joking aside, I mean, the last 4 years have just been rough, right? When you think about kind of the U.S. response to the COVID-19 pandemic, and but it was. I don't want to say it was based on an ethical principle, but it kind of was, right? This gambler's principle where you boil it down basically to the worst, and then you kind of give it a political spin. And it's based on this idea, don't bet more than you think you can afford to lose. And it's that you think part that's limiting, because it's not really based on science so much as just kind of your gut response. I think that's where the gambler part comes in. So yeah, like let's not think about influenza. Let's think about kind of the bigger, scarier, but much less likely threats like bioweapons or terrorism. So that's, like I said, that's part of the left-hand side of our thinking as far as ideal principles. The next one is more commonplace, called prudent vigilance. And this is where I think a lot of workplaces kind of land. You do what's prudent, you do your due diligence. There is a process, it can be based on quality improvement and all of these very important things. And so that's great. The only challenge is that it's still kind of, putting in the bare minimum of what you think you knew. It's prudent, right? You don't overthink it. But then the other way of thinking of it is, you don't do much until you kind of see the whites of their eyes, or you see some smoke brewing in the distance, or you see your competitors or other people in your community stepping up and doing something, and you're like, well, maybe I should do something now that I see other people doing it. So I'm not saying that this is always wrong all the time. It's just it's not the most ideal. But there are resource limitations, and I understand that. Health and safety is still seen for many as this like kind of overhead cost or something beyond just for the sake of the wellness and benefit of your workforce. So unfortunately, that's the capitalist world that we live in. So it's a little bit more linear in its thinking when you think about risk. So adding a third element, which would be the human factors, sometimes gets overlooked. So because you might be kind of trying to catch up, and that's not great either. So you want to kind of anticipate some of those human factors when you're thinking about risk. So the third one here is the precautionary principle, which is how I think we've mostly been up until relatively recently. I think we're understanding the virus more and more. But when we don't know what exactly's hit us, we just put in everything in the kitchen sink as far as preventions. I think at the OHC, we have certainly been promoting this idea around ventilation practices and the use of PPE and prioritizing that for workers who may be on that kind of middle of the whole risk profile. They're not healthcare workers, but they're not working in their own private office in a corner, but they're somewhere in the middle. So in the absence of further data or evidence, let's still give them the protections that would be the best. So once again, this is probably the most moral, the higher level way of thinking about it. The fourth one is the prevention principle, which is kind of the ideal, where we understand a threat. We understand, if this was our second or third pandemic, which of course we had SARS back in the early 2000s, and countries in Southeast Asia seem to have learned that lesson fairly quickly. And we can tell by their response to COVID, they've been a bit ahead of us here in North America. So they took the time to actually anticipate and break apart what the threat was, and then you create a very tailored prevention response. And that doesn't have to be more expensive; it just is more informed. And in the case of a pandemic, that it's cyclical, right? This is Mother Nature's way of saying, okay, human beings, let's come to a new equilibrium. And so, of course, we want to protect ourselves as best we can, and that requires, it does require a very invested strategy, and unfortunately, prevention tends to lose its sex appeal, for lack of a better phrase, compared to kind of more crisis or big disaster kind of response. So anyway, just remember, this is kind of where we're hoping to head someday. Now, the ethics of good decision making. So I have this little scenario here, and this is your chance to also weigh in. Your workplace joint health and safety committee and HR department conducted an assessment and found that remote workers are feeling more isolated and less engaged. There is concern that this is negatively affecting morale, mental health, and productivity. So a working group was formed to begin brainstorming solutions. The initial ethical principle that brought about this outcome is, okay, oops, it always does that. Here we go. We're going to go to the next. Here we go. The initial ethical principle. So there are your four choices. If you are experienced in health and safety and you've heard of these principles before, you might know this right off the top of your head. For those of you where it's a little new, you might have to scratch that noggin based on what we've been talking about. Okay, so we're at 72%. Some people are thinking hard. I think I'm going to go ahead and end it. Share the results. Oh, wow, we got quite the split here. 18%, 27, 27, 29. Okay, so there is a correct answer to this, and that is the prudent vigilance principle. And you might be wondering why. Well, that is because, remember, prudent vigilance is like I said, it's not a horrible thing, but it is imagining or seeing kind of things on the horizon, seeing, like I said, where there might be some smoke, and then you decide to react. And like I said, that's a good thing. In an ideal world, you'd want to move a bit more towards the prevention side, where you would anticipate that in a remote work setting, folks would be stressed and it might lead to some mental health challenges. in which case you might have preempted that and put in some policies and procedures that would have made life maybe a little easier, and that smoke might have been tamped down ahead of time. So that is truly what prevention is. You intervene before there is a problem, whereas prudent vigilance is there's a little something going on and we don't want it to get worse, so let's get in there and try and stop it. So we had a wide array of thinking on that, and that's okay. It's good we all thought. And precautionary, remember, precautionary would be you know, similar to the prevention, except that a little less targeted. You're just kind of, you know, putting it all out there as far as preventatives in terms of mental health. So that one can be tricky, but in this case, we were looking for prudent vigilance. Great. Okay. So this graphic actually came from the course we taught a couple years ago called A Hazard is a Hazard around workplace psychological health and safety. So some of you might remember that. This is the 11 point wheel, we call it, around the legislated 11 parts of a fully functioning safety and health system in a workplace. So I'm certainly not going to go through all 11 for the purpose of today. I want to bring us back to this way of thinking. Okay, and so you were required to have a plan, every workplace, right? When this horrible crisis hit us. So, you know, at this stage, the purpose of today is to just stop and take a minute to reflect on kind of where you're at. Think about maybe some areas where you've got a few gaps or some potential improvements. And I'm hoping you're staying up on the current public health orders. We're going to talk a little bit about that in a minute, but for the most part, I'm not going to go through that line by line either. I find them very readable, all 32 pages, and I know there have been a few modifications since last week when the last kind of expiry date happened. So really kind of understanding what your industry does and what those unique safety measures need to be. So that might mean, you know, if you're coming from a trucking industry, or if you're coming from a retail, or you're coming from certainly healthcare or some other social service venue, understanding where the risk lands for different groups of workers within your, of course, current workplace. And not every jurisdiction is doing a great job of providing specific supports to each type of industry. So I would recommend looking at other jurisdictions if you can. For example, I had a manager from a local pharmacy, retail pharmacy here in West Broadway, call and just ask about, you know, what are some guidelines for retail pharmacy? They went on to the Manitoba government site and they weren't finding anything specific for them. So, you know, I conferred with folks in my office and then did some other poking around, and sure enough, WorkSafe BC had some more specific guidelines for retail pharmacy, and their finding was it's really more retail than it is pharmacy. Like, you really have to treat them like, you know, like you're a cash register or you're dealing with the public in a front face there. So but really, by doing that, I mean, a lot of kudos to that manager, because she wanted to go back to her staff and say, hey, look, I did everything I could to find the best guidance for us, rather than just some broad, you know, so because people appreciate that. People appreciate when the leadership goes out of their way to find the evidence that's going to be, you know, really going to ring true for their staff. So I thought, more than anything, that's creating a sense of psychological safety, which we'll definitely get into. Once again, this is the kind of part that gets overlooked, kind of monitoring evaluation. That's that plan, do, check, act kind of cycle. I'm not going to give you a lot of specifics on that today, but just remember that, you know, maybe use this presentation as kind of a point of, all right, let's maybe go back and take a look at what's working and what isn't. And once again, involving stakeholders at every level, and that's going to be different depending on who the worker is, where they work, the type of job they have. including other stakeholders in your workplace, like even your contractors. You know, you think about the cleaners, the people who may not receive a paycheck from you directly, but who are in the same space, right? And potentially exposed to other things. And, you know, of course, if they're cleaning, that's part of their job, is to keep it clean. But I think anticipating kind of the holistic nature of everything that happens within the space that you operate is really important. So once again, we're definitely going to talk about the virus itself, but there are a lot of other hazards that come out of COVID-19. And many of them are psychosocial or just social or economic, right? And I'm not going to read through all of these except to just say this is probably going to look familiar if you're reading the news or if you're thinking about your own kind of personal life and what you've been up against. It's a very stressful time, and the workplace is one very, very important place that either helps or hinders kind of certainly the transmission of the virus, but also it modulates other important areas of our life, right? If you're fortunate enough to be employed, and of course that's also a privilege at this time, you know, unemployment is certainly higher. So I want us to remember, like, this is damage happening to us as a society that's beyond just the physical that happens when you have symptoms and you end up in a healthcare setting. So kind of chipping away at this, and this is what makes a pandemic so much really a tough nut to crack on so many levels. So I'm treating this presentation as a bedrock for anyone who's listening. For those of you who know the hierarchy of controls, you're gonna be like, okay, I've done this, I've seen this. So just bear with me. I think it's good to refresh and review the principles that bring us the best kind of outcome when it comes to health and safety. So when we're eliminating at the source, right? So this is ideally where we want to be. We want to, in this case, if it's transmission of the virus, removing the hazard, which involves remote work, keeping folks out of the workplace as much as possible, but then don't, having a process for that, of course, right? And related to that too is all these things in the middle, right? What we call the pathway, redefining job tasks, roles, what sorts of policies do you have to have in place, additional training. So all of this is going to be in, hopefully in some of your planning. You'll have already done this. And if you've got folks on staff who specialize in health and safety, I'm hopeful that you've got some of this in place. It gets tricky when you're dealing with some of the psychosocial elements, and we'll cover some of that. Finally, depending on what sector you're in, for example, in healthcare, PPE is very, very important. I mean, it's important everywhere, but they're considered one of the higher risk groups, right? So having that sort of equipment for workers is crucial. But that depends, right? The risk might be a little different depending on where you work. But the most important take-home message, though, is that you don't just stop there. You don't just say, okay, here's your N95 mask or here's your surgical mask and go along your merry way. You have to have other pieces in place, right? And that's why they say it's the tip here. It's important, but it cannot be your entire safety plan. I have mental health first aid on here because from a psychosocial standpoint, mental health first aid, like physical first aid, is a reaction to a potential crisis or where there might be some sort of mental health challenge or something going on under the surface. So it's extremely important from a psychological support standpoint. But once again, it's not a matter of just sending your staff off for training or improving even mental health awareness. All of that's really, really important, but it can't be the end all, right? You actually have to have some work done around the management side, the operational side, scheduling, those sorts of things. Yeah, just highlighting that. So this is another kind of diagram that I kind of whipped together. So when you're thinking about hazard identification for COVID-19, there were other hazards, right, on that slide I showed you earlier, but we're really focused on the viral transmission. So that needs to be heart and center of this. And unfortunately, that means human contact, limiting that human contact, being within or beyond, outside that 6-foot radius. So understanding that will certainly inform the rest of our risk assessments. Risk assessment is really the heart of this. So once you've identified certainly viral transmission, now you have other variables that get kind of messy. I'm going to go through some tools that kind of help guide you through the risk assessment part. But I would say that some of the gaps actually involve other kind of layers to this onion, which might include, certain aspects to the job, the geography, the power dynamics, that some of those psychosocial risk factors are also there, which I have listed, and aerosol transmission, which is only relatively recently becoming more and more pronounced, certainly with the variants coming about as being more transmissible, needs to be more front and center. Okay, so then, of course, the next step is identifying your controls based on your risk evidence, or your risk banding, as they call it. So I'll cover some of the steps you can do for that. There are 3 broad kind of buckets with regard to controls, right? Your administrative controls. So those are some of those pathways that I mentioned earlier. Engineering controls, of course, involve your some of your physical barriers, more workstation modification and things that like mechanically stop transmission, but also can include, there's kind of a blend between administrative and engineering around scheduling and kind of workflow, let me put it that way. And then, of course, the worker level controls are the PPE and other kinds of training and things you can do at that point. And then, of course, monitoring and evaluation. I've been doing some reading. I don't have enough to really share during this presentation, but kind of the psychology around forming habits, good habits in people. I know emphasis on behavior can get a little sticky, and quote unquote compliance with regard to safety compliance. I mean, certainly there are requirements, but there are things you can do in a group setting, and a kind of and this gets back to psychological safety, where you make it easier for people to make the right decision. And it's not just about willpower, it's actually about kind of help paving the way for them to make the right choice. So I'm not going to get too much into that, except that I think that there's some strategies we could use in health and safety to help people kind of see the value in making the right choice. So I'm sharing my screen here, and bear with me. I'm going to go now to my document page here. I like this. So this is I'm going to go through some tools here quickly. The Workplace Self-Assessment Checklist for COVID-19. This is put out by the government, Workplace Safety and Health, and it's good. I actually think it's better than some of the other jurisdictions that I've read. Safe Work BC has one, but their use of white space isn't really great. Whereas this one actually has columns and space for you to write, and really good thought-provoking questions. And so the first section here is about understanding the worker, which I think is fantastic. You're putting the worker front and center and trying to understand kind of what their concerns might be. But if you are if you don't have psychological safety in your workplace, meaning you don't allow, it's not easy for people to really share their concerns, they're worried about sticking their neck out, then answering some of these questions and getting whole answers could be a little challenging, right? Who's vulnerable? Who do you have a way of actually, there's a really good one in here, a process for workers to self-identify if they are vulnerable. I mean, that right there is at the heart of providing a safe space for people to express, right? If they might have a medical condition or something that might put them at greater risk for the virus, right? And then in here, they go through the different forms of controls. But it's a very much kind of an easy question and answer kind of thing, and lets you kind of reflect on it. So it's 9 pages long. I'm not going to go through all of it, but I really recommend it. It's I was quite pleased. As much as some of what the government has put out, I'm like, well, you could say more about things like ventilation, or more mask mandates. Quite frankly, this is still good. So I would recommend that. The other piece here, so OCAL, the Occupational Clinics, Occupational Health Clinics for Ontario Workers, they're one of our partner agencies over in Ontario. They have this really helpful kind of, they call it a control banding matrix. It's based on some research also out of Great Britain. So it's very much an industrial hygiene kind of approach too, which I'm not one of those people. But it helps you kind of identify which column you might land in. And so, I mean, even in this green column, so most workplaces are going to be in the green here. They do recommend certainly physical distancing and wearing face masks as much as possible. And I'm going to talk a little bit more about that in a minute, but it's short, it's 2 pages, it's quick. They've got some other documents and resources here at the bottom. Okay, so we can either post these or certainly send links to people if they want to look at this more closely. I'm going to keep going here, back to my slides. So yeah, I like that control banding approach. It's actually understanding, and OCAL did some research around kind of regional assessments across Ontario to understand what geographic areas, right? Because you do need to kind of understand kind of where the virus is operating on that community transmission level. And so in an effort to help be more prevention focused and give kind of more of a targeted option for people, not loosening things inappropriately, but providing kind of some more context and nuance on what sorts of risk strategies you might want to employ. So I don't think we have anything like that in Manitoba. We're not big enough to probably do that kind of assessment across the region, but I just thought it was neat that they did that. So to kind of cap off this discussion about risk, I really want us to once again kind of think about this a little bit more conceptually. People I work with, I don't know how often they shake their heads, but probably more often than they would let me see, that I spend my days in the clouds, or at least I'm a conceptual type thinker, and then I try and make it practical. It's kind of my funnel approach. But I think in this case, it's important to think about, how do we square personal needs and expectations with the social solidarity required to collectively beat a deadly foe, right? And so I remember earlier on, I mentioned social solidarity as being really important. But in this, I mean, I'll be frank, it's a toxic environment as far as information. It really is like choose your own adventure with regard to where you're getting your so-called evidence, right? And so I keep coming back to this important thing is appealing to people's humanity, right? And that we have to respect each other. I have in-laws who are very pro-Trump. They live in California, and my partner, it just drives him nuts. And it's frustrating, but it's like we need to love these people. They're still in our lives, right? And so I think the good thing about having a prevention mindset rather than graduating from a precautionary to a prevention mindset allows us to say, hey, look, we recognize that there are differences in people and in circumstances, and we understand the virus even more, and now we're going to move towards a prevention focused mindset. Because historically, when you think about public health interventions, it is a bit of a numbers game. You want to help the most number of people, and so it's too easy to kind of do a all or nothing kind of approach, right? Abstinence only campaigns, or just say no to drugs, and these don't always work, right? I mean, not everyone can eat whole grains. Not everyone, if food is medicine, then let people have a diet that's going to be more personal, right? Personal for them. They talk about personalized medicine. And so I think, the coronavirus is going to be with us, in my opinion, forever. it's going to just fold into all the endemic diseases that we live with as a species. And so I think we need to move towards more of I mean, I think about like a harm reduction strategy, right? I mean, I read an article recently about vaccines, and people who get vaccinated, you know, they talk about how the first thing they want to do is hug somebody. And you're like, okay, well, actually, maybe you shouldn't, because the virus can actually still kind of be up here in your nose, and it may not infect you, but if you're not wearing a mask and keeping distance, you can still spread it, and not shed the virus in the traditional sense of you know, all the other mucous membranes that are involved. But there's research to show that it just kind of hangs out right there, and that's when you know, if you're breathing and singing and talking too loudly, that can be a problem. So imagine what that feels like. You know, you've been waiting for that vaccine, and now they're telling you, no, gotta continue with this. Whereas we know if two people who are vaccinated, more than likely the risk is going to be a lot lower if they're, you know, within close contact. So I'm not suggesting that if you're vaccinated, you're off the hook and you need to stop with all of the social distancing. I just think that there will come a tipping point where you don't want folks to not trust the vaccine and not trust us as experts, that you know, we're just making their life more miserable. Like, what good is the vaccine if there's no, you know, like, what do they get? What's their part of the deal? And that's another human reality. And so I think there is a place for that. And it doesn't help to be what I've kind of invented as being a pandemic prude. It's easy to shame people who just aren't with the program. And it's hard when it's people in your family, and you have every right to protect yourself and be very direct about that. But I think we need a more, and I don't know what the answer to that is right now. I just know that as this continues on, we need a strategy that's going to help bring us back to kind of our human center. The little coffee cup in the lower right was just to remind me to talk quickly about another little vignette I read about a coffee shop in a little conservative town in Montana, up in the mountains. And this was a person, a barista, who was sharing her story about, you know, the need for wearing masks. And there was a mask mandate in that state finally. It took a little while, but some of her patrons just refused to wear a mask. And so this person, it read like a diary, the way she was responding to it and reflecting on it, and how it created that anxiety and stress. And with each little story she told, it sounded more desperate and more, it really hit me, because it was like, this must be what it's like for folks who are faced every day with this, you know, whether there's a plexiglass barrier or not, like, you're there, you're on the front line. And so in her telling of the story, she talked at the end about how she was so like anxious, and she would be curt and short, and she knew she was coming across as being rude and seemingly inconsiderate. And the last story was of a boy, probably a teenager, who wasn't taking a mask, because they were offering them, right? Please wear a mask. And he's like standing back, like, no. And she like basically pushes it on him. And I mean, I don't think she pushed him, but he said, listen, lady, you know, I have a condition. I can't wear a mask. I just can't. We don't know if it was asthma or something else, but it was interesting to see how, from the worker's standpoint, they, like, socially or psychologically, they felt so unsafe that their behavior was becoming kind of frantic. And then they couldn't stop and think about, oh, wait, there are exceptions to the rule. There are people who can't wear masks because of X, Y, or Z. And so for me, it was a full circle way of thinking about, you know, we can't come across as too binary and too strict. There has to be some, you know, anyway, I just, like I said, I can get lost in my thinking here. And so thanks for bearing with me. Probably spent too much time on that slide, but I think it's an important consideration. So about the variants, okay, so these buggers, I've been following the news on this. There have been at least 3 major ones, and then now there seems to be some more coming out of, well, the US. Southern California had one, or they are saying it's possibly driving a lot of that epidemic in that state. So that's a little close to home. Okay, so I'm going to explain this graph. I found this. This was from the Evidence Synthesis Network out of Ontario. And these are by mathematicians who kind of are modeling what's going to happen when the variant really kicks into high gear. And a lot of people are projecting by March, it will become the dominant strain in a lot of places. So VOC stands for variant of concern. And this variant, I believe, is the one from Britain. So it's the one that they know increases transmission from anywhere from, I've heard, from 40 to 70%. So remember that the gray buttons or the gray dots are both of them combined. So you can see what's happening. It's swooping up. And so they're not too concerned about the Britain strain being vaccine resistant, but the one out of South Africa, and I think to some degree Brazil, they are more concerned about the spike protein on the virus having been modified enough to be a problem for that. The good news about the mRNA vaccines that are being produced is that they can adapt and change those in about 6 weeks or so. But once again, we're back into this idea of an annual, semi-annual series of shots that people are going to need. But it really is the logistics of getting that out and getting the herd immunity and getting, I think it's like 70 to 80% of the population covered. So we are in a bit of an eye of a storm, if you ask me. It is concerning. I don't know that Manitoba, I tried to look up whether we were tracking our own variants. I didn't see evidence of that. But I think, actually, you know what? I think maybe at the federal lab there near HSC, I think they're the ones looking at it. Come to think of it. So just as for your own information, variant, the SARS-CoV-2 is the strain of the virus, the coronavirus, and variants represent different collections of mutations, which are the genetic changes that create different clinical presentations. So the strain is one set of clinical, kind of a known set of presentation, and then the variants kind of tweak that to some point. For it to completely change to be a new strain, I don't know exactly what the criteria is for that. I'm just glad that there doesn't seem to be an increase in lethality, as they say, or deadliness, but it is transmission. So that means more cases, more hospitalizations, and just by basic numbers, more people potentially dying. So that's why really the take-home message is keeping up what we're doing already, even if you are vaccinated. And like I said, that's hard to hear if you've been waiting with bated breath for that vaccine. And I know in Manitoba, we are rolling out vaccines, although it seems to be a bit on this low side. So yeah, from what I've read, thinking about the gaps, right? I mean, for me, like I come into the office once or twice, probably once a week now for a while. But limiting your trips to shops and stores even more. I mean, this is once again above and beyond what certainly the public health orders are saying at the moment. I don't know that they have factored in the variants. But depending on your own risk tolerance, personally, it's more of the same, unfortunately. But really the evidence or the continued thinking around ventilation and that prolonged indoor exposure. So this little video is showing you like what happens when the particles continue to accumulate without proper ventilation. And so anything greater than, they say, about 15 minutes, even with masks on, is a real problem. I do want to show you, this is a really cool website. If I can find the right one here. Oh, I lost it. Hopefully you can see that. So this is actually out of Spain. This is such a great visual thing. So if you want to show this to workers, or even if you have a health and safety committee kind of gathering and you want to show, it demonstrates kind of what happens if you have one person in a room without a mask and they're like patient zero. And like in this example, 6 people, this is in Spain, and they're in a private house, and 5 would become infected if they didn't have masks on, right? And then they say, okay, well, if people wore masks, still 4 people would be at risk for infection because of the prolonged exposure and because of the aerosols, right? And so if you add ventilation and people are still wearing masks, you can see immediately how it shortens the length of potential exposure. So this website, for the sake of time, I won't go through all of it, but it kind of shows you a setting in a bar or a restaurant, and then it shows you schools, and it kind of just, it's kind of a neat visual demonstration. And once again, I could do a whole presentation. I'm not a ventilation expert, and I'm not an industrial hygienist, and we have other people in our orbit. Certainly, OCal have more experts on tap than me. So I would definitely defer you to more of those resources. But I will just say, you know, aerosolized transmission, which are the small little diffused drops that can escape you, even though you might be talking quietly, these things, if left unchecked, will circulate to the far side of the room. And so it's been underestimated, and it's only been relatively recently that even the WHO, the World Health Organization, has said, hey, this is something we need to pay attention to. And so it has been more focused on those larger droplets that tend to fall to the floor or fall within close proximity to people within that 6-foot radius. So we're talking about the little pieces that get thrown about. And not every jurisdiction is treating this the same. And so, like I said, our own Manitoba jurisdiction is not doing a great job of really emphasizing this, in which case, if you want to be an employer who's ahead of the game, thinking about your HVAC, your health, or excuse me, your heating and cooling system, that's really important. So taking a precautionary approach, right? So there's that word again. Even if you are maybe considered a low risk kind of setting as far as potential exposure, it's still really good to take a hard look at your HVAC system. So the ASHRAE, which is they're the I can't say that it's an engineering association around cooling and refrigeration. They're like, they've become kind of the standard bearer experts around ventilation and indoor air quality in basically the world, or at least North America. And they have a lot of recommendations for COVID, different scenarios, different types of settings, but also kind of some standalone HVAC recommendations. So I'd really recommend going there. In fact, I think I have their website opened up. Yeah, so ASHRAE has a lot of stuff on here that's really good. Core recommendations for reducing airborne infectious aerosol exposure. I love how Zoom likes to cover up all my tabs for things. I need to move this down. Sorry, bear with me here. I was going to point out that we have ventilation resources on the OHC website. Okay, so we've got a lot of stuff in here. We also have a fact sheet, which is over this direction. So this is hot off the press. Open for me, there we go. So this is kind of, once again, introduction to hazard identification and assessment, and then tips and things for workers, talking about particle size, indoor airflow. So this is a quick reference for you. Otherwise, another really good one for more than just ventilation is the CSA standard here around reopening during the pandemic. So 76 pages. That's also a really good resource. And oh, I didn't show it, but OCal actually also has a really good ventilation checklist. So that's on our website. I also want to emphasize the importance of not all masks are the same. Okay, simple cloth masks are certainly better, like and required in indoor settings, certainly public settings. But understanding that certain workers actually could use more than that, surgical or N95 respirators. The argument could be made that even grocery store workers, people who are exposed just in the general public, and it's not like a giant auditorium or anything, they deserve more. So understanding when it's appropriate to have one or the other. I would just point out, if I go back to the public health orders, I did a search for mask. Of course, they have a mask section in here, but they don't require, even if you're an employer and you operate an indoor public space, you're not required, certainly behind the desk, so to speak, or the front desk, to have masks worn in the back. Here at OHC, I mean, we're a healthcare center, so we have to wear masks in everywhere else outside of our personal offices, to the washroom, in the hallways, lunchroom, all of that. So even though it may not be like absolutely required in your workplace, I think especially with these variants, especially with things that are changing, it would be really, I think, a precautionary approach, a recommended approach for employers to go the extra mile on that one. And once again, I've talked about this a bit, right? Not everyone can physically separate. So in that case, a cloth mask isn't good enough, and you would need like really giving people better respirators, better N95 masks, for example, is really important, as well as other kind of economic supports. So that's not always going to happen from the government, and it doesn't sound like the government's even necessarily recommended in every case. Yeah. So more government oversight and regulation for high-risk congregate locations, so retail and service sector. Not to see, and this is what's hard. You don't want to add extra burdens on these sectors, but unfortunately, it's still where a lot of the high risk takes place outside of traditional settings. They no churches, no gyms, nothing like that. So anyway, it's up to employers, I think. So what can you do? So this is just kind of a quick summary slide before we move on. Reviewing your ventilation practices and social distancing. I would recommend wearing indoor masks in all shared spaces, including hallways and workrooms. And then screening employees before they return to work. Now, this is kind of an evolving thing. There are rapid COVID tests now, and some employers may require a vaccination. I'm not up on all the latest on this. And once again, whether this comes, it's probably going to be more of a provincial level set of guidelines. I'm not sure when that would come. Certainly healthcare is its own ball of wax. And then once again, strategies to promote psychological safety. So including improving your communication practices and understanding that your workers do have a right to refuse unsafe work, and just honoring and respecting their own risk tolerance, right? And you're only as physically safe as you psychologically feel safe. And I think that's what gets kind of lost in the cards sometimes. So in the last part here, and I've only got about 23 minutes, so I gotta move it, but this is kind of more where I get excited because this is kind of my area, is workplace psychological health and safety. It truly is the glue that holds everything together. And I know for many of you today, you chimed in and said, it's the remote work, it's this isolation, this difficulty in trying to meet everyone's mental health needs when we're all so isolated. So there are 13 psychosocial factors that have been pretty well researched, and there's a CSA standard around this as well, if you're familiar with it. For the purpose of today, and really for me, the COVID crisis, kind of these 5 are the ones that really jump out at me. I know civility and respect, certainly in a virtual environment, that might change into something else, but I think it's important to consider certainly involvement and influence and psychological protection support, giving people a chance to share their mind. So I have a little thing here, and I might go about 5 minutes into the Q&A, so pardon me, it's really hard to get these things timed right. But Dan is a supervisor in a department of 50 workers. 11 people report directly to him. Since the first wave, the pandemic hit last year, his workplace went nearly 100% remote. There wasn't a lot of direction from upper management and how to coordinate the return to normal. Since reopening this past month, he's now faced with a situation where 3 out of 11 of his workers insist on continuing to work remotely. Dan knows there's currently no policy on how to manage this situation, but he decides not to bring this up with his boss. It would make his life a lot easier if everyone simply returned to their desks, but he knows there are certain family situations and health concerns that are complicating these decisions. So let's go ahead. For Dan here, what do you think is the priority psychosocial hazard in this situation? I gave you 5 choices there, or 4, and then if you don't know, you can say they all look bad. So it's unclear leadership and expectations, I guess for the listeners or for the recorded folks, questionable psychological safety, problematic workload management, poor work-life balance, or they all look bad to me. So we'll see what happens here. Okay, so we got about 75% in the polling. Okay, so sharing the results. We have a clear winner here. 67% said unclear leadership and expectations, followed by questionable psychological safety, or they all look bad to me are the next 2 choices. So interesting, when I first put this scenario together, I was trying to direct the reader or the person in your situation answering the question towards questionable psychological safety. And I even put in a question or a statement, a sentence that said, you know, he didn't feel comfortable raising his hand and saying, okay, we have a problem here. But honestly, it really does read as an, you know, leadership is failing. And so it's kind of like a chicken and egg kind of situation. And so there really are kind of 2 answers here. I understand why certainly unclear leadership and expectations tends to be the one that really jumps out. But on the heels of that, of course, would be like, okay, but there's still no space for him to say anything. And so is it the culture of not being able to say anything that, you know, what comes first? And the truth is, I mean, they're both equally bad. So anyway, I think it does demonstrate how some of these psychosocial factors kind of overlap. And that's just the way it goes. So anyway, good job. Let's go ahead and stop that part. Got one more question after this, and then we're done. Yeah, there was my question there. So psychological safety, I'm going to talk about this. And what it is, this author and researcher says is the belief that the work environment is safe for interpersonal risk-taking. The concept refers to the experience of feeling able to speak up with relevant ideas, questions, and concerns. Psychological safety is present when colleagues trust and respect each other and feel able, even obligated, to be candid. So Amy Edmondson, she's from the States. She's actually from the Harvard Business School, which, depending on your point of view, is either a good or a bad liability. I'm not sure. But I have another slide where I talk a little bit more about her research. But the truth is, you know, and maybe you don't agree with this. This is kind of what we're trying to dispel here. Is it are you overreacting to ask for what you want and need, or is it only what you need? Are you only, as a worker, are you a collection of needs and you couldn't possibly ask for what you want, right? And I mean, heaven forbid, what you want might actually soothe you from a mental health standpoint, right? And as if that's some kind of like icing on the cake. So really, it does kind of come back to how you as a workplace and as an employer and a supervisor, how you view and value kind of the human element in people. Are they hired hands, or are they a part of a budget line? And when it comes to kind of trimming the fat, so to speak, that's what labor is to you, or is it more of a relationship and a reciprocal arrangement, right? And so I think that's getting down to the heart of what a healthy, psychologically balanced workplace should be, in my opinion. But there is research to show it. And so I'm shamelessly plugging her book here. It really is a great book. Amy Edmondson originally did her research in healthcare, looking at teams to see why some teams failed more than others. What were the variables? What were the things that led to negative outcomes from a patient safety standpoint? And she kind of stumbled across or kind of articulated what really the issue was, and that was psychological safety. And in the book, she frames it as, we work in very complex, knowledge-based psychosocial environments, and we're social creatures. And so it is, it's a group dynamic. This idea that, when I'm doing mental health awareness training, I ask questions like, is mental health 100% your responsibility, or is it something else? And in my opinion, I guess, but research also shows that your mental health is very much dependent on the environment with which you're in, right? And it's the same with this idea. So it is a shared responsibility. And it's so she gets into the psychology of how we kind of overweigh other people's perceptions of what we think they're going to think of us if we, say something, or we stick our neck out, or maybe they look at the patterns of how they think other people have been treated, and so they don't want to do that. So it's normal, but just because it's normal doesn't mean it's something we want to necessarily encourage or stifle. Like we want people to be their honest selves as much as possible. And so on the heels of that too is this idea of feeling in control and valued in your work and what you do. And so that's why saying thank you is kind of a big deal when it comes to your job. And then naturally it takes leadership to model that kind of trust and respect. So it is, you certainly can build it into existing procedures, which is, I think, why I kind of liked that that purple bannered workplace self kind of assessment, is that for each one of those questions, you could almost ask like, how could you make each one a little more psychologically attuned? And then if you're coming from more of a business standpoint, it does enhance teamwork and improve the bottom line. And it's interesting. So I just found out, actually, I don't know if you read this in the news, but Costco in the US just recently, they're giving their workers another $2 an hour, which for some is like a 20% bump in pay during this time, during COVID. And Costco has been doing very well from a profit margin standpoint, so they can certainly afford that. But they already had a strong history of actually supporting their workers. So I think it's possible. And it just depends on how you define your bottom line, right? What is your bottom line? Does it have space to include more of kind of a psychological or psychosocial element? And yeah, so this is once again, this idea that your physical and your psychological protection are like kind of two stars that rotate around each other. And when I first used this metaphor, I thought, oh, okay, well, I'm not an astrophysicist, but I like the idea. Let me think about it. So I looked into it. And sure enough, binary stars, the reason they rotate around each other is because one is actually sucking the life out of the other. And then they eventually, boom, supernova or whatnot. And as I was thinking about that, I'm like, that kind of fits because, historically, as health and safety as a profession, we've focused a lot and we made a lot of important progress around the physical domains and physical hazards and addressing those. But are we thinking hard enough about the psychological parts of this? And so it's kind of like this appendage, this, appendix now just kind of hanging out, or are we actually going to give it the attention that it deserves? So that's why I'm becoming more and more grounded around this idea that the psychological safety piece is really critical. So as I kind of figured, I was going to show this video, and my apologies to my OCal compatriots. I'm not going to have time at this stage. I'm going to start eating into my Q&A. But I really recommend folks go to this website, OCAL's website, and watch this. It's just a 9-minute video by John Odick, and he talks about Peter Smith from the Institute for Work and Health, and how they did a series of surveys for healthcare and non-healthcare workers in Manitoba, looking at what their experience has been with the pandemic, and kind of where their feelings were around being properly supported, a lot of it from a PPE standpoint or from infection control, whether they felt like they were being adequately protected. So they did that, and then they also asked them questions around there are these quick kind of quick anxiety and depression scales you can do with folks. It's kind of a clinical tool as well, but you can use them in surveys, and they actually found correlations where for people who were not getting adequately supported, like they were expressing that, and then they were creating what could be considered symptoms, and some of them were clinical, like could be considered diagnosable. So they did this last I think it was last spring, and they published those results, and they're doing another round of surveying, and anyone can sign up. So I would definitely go. I can at least show you the website, so that way you kind of know where it is. And then we're going to be wrapping up here in a minute. So yeah, pandemic experience and impact. And their conclusion was that, we cannot continue to ignore the mental health, certainly of frontline workers. In this case, a lot of the emphasis was on healthcare workers, but they were finding similar trends in other industries. So I always like to include, because I always wonder, like, where's the research? Where's the, we need some metrics to actually demonstrate that the mental and the psychological are being impacted by the physical and vice versa. So kudos to them for that. I'm going to go back to my screen here. And yeah, and once again, this is a slide I've used in some of my other presentations around stigma, mental health stigma, or in this case, self-stigma even, and psychological safety. So they did a survey, and I don't have the details off the top of my head, but 83% of the folks said, there's something going on in my life, probably about, maybe it's a mental health challenge, and so they feel like they need to say something, but the flip side is only about 30% felt safe enough to do that. So you can imagine, I mean, if one of the criteria of understanding kind of the risk to your workers and the risk to your workplace, if you don't have a healthy conduit to actually communicate self concerns and what's going on, then you'll never get to the heart of what's really going on, and people will suffer. And we don't have time to talk about this much today, but your duty to accommodate and to follow through for people as an employer is absolutely critical at this time. But that's where I feel like psychological safety is really the linchpin to this, because if you don't have it, you're never gonna find the truth. And what happens then, of course, is you start getting these kinds of outcomes, right? You can't figure out, why are people quitting? Why are people reporting such high levels of stress and burnout? Folks are afraid to come back, and it's so this is the result of psychologically unsafe work. And you can see, once again, just pulling back some of the elements I discussed earlier around the pandemic, is that without psychological safety, then these elements, these kind of complementary hazards, continue to worsen. So I've got about 4 slides left, and then I'm done. So actually, I'm going to get finished on time, which is amazing. I always worry about that. But I have some tips here. If in the future we do a more robust 2 to 3 hour kind of session, or even 3 to 4 hours, 2 hours is suddenly feeling not quite long enough. But at any rate, having more opportunities to really explore kind of options for people because I think it does create some, it requires some creativity, and you know your workplace better than anyone like me. So these are just kind of some general ideas. Saying thank you. You might have heard the idea of love languages, which is, I'm not sure if it's still in fashion or not. And I don't know if it's a Christian counseling thing or if what the research is, but it's in popular culture. This idea that, some people, words of affirmation are what is how they appreciate to be, they feel valued when they hear that, or you spend quality time with them, or physical touch, which unfortunately right now those folks might be having a harder time. What are some of the other ones? Physical touch, quality time, words of affirmation, and gift giving. That's another one. So at any rate, understanding kind of what people's needs are as far as feeling valued, and I think that's kind of where management could shine, or people in leadership positions, I should say. And similarly, I have a whole nother set of slides where I talk more about what compassion is and kind of some of those mechanics of that. And I don't have time today, but if you see it and it's noticeable and it's a great thing, certainly with permission, ask if, can we share what can we, because the more you share, the more you talk about kind of these successes, the more it kind of catches on even. And there's actually organizational research to show that the more you emulate and pass on and share kind of acts of compassion and support, people, whatever their motives, even if their motive is kind of not so great, but they want to kind of fit in, they might be a little more thinking about themselves. But if they want to look good, they might actually act in ways that promote kind of more of a collective sense of compassion and psychological safety, which I find fascinating. It's like whatever motivation it takes to get people to kind of act more in a sense of solidarity in that way. So transparent safety planning, I mean, that just similar ideas of, having your meetings with your committees, allowing for people to openly share it and offer up their concerns. So that's a lot of communications there. So once again, this is a little boilerplate, a little maybe obvious, but understanding what harassment looks like right now, and I'm not sure, right? I mean, if you have a team-based environment and now you're all far-flung and remote, what does it look like when someone feels like they're being bugged too many times, or harassed, or just like, leave me alone. Like I can work without you on my shoulder or looking over my shoulder. So understanding how people are feeling about those sorts of things, I think is really crucial. And then employers should expect variable productivity and don't be so hung up on a business as it was before the pandemic. Okay, and reattuning kind of where those expectations are. So once again, that's back to kind of that clear leadership and expectation. And likewise, that encompasses flexible scheduling. I mean, for me, the remote work thing is working pretty well, but that's not the case for everyone. Some people, if you already live alone, or if you used to get a lot of social connection by being physically present at work, those are the folks who are probably suffering in silence a bit more, and you may want to consider ways to support them. And then I had said this earlier, right, when it comes to getting stakeholder feedback, understanding different points of view, because I mean, like I said at the onset, like we don't know what everyone is experiencing. We can't judge, we can't assume, and you can only act when you know kind of what the fullest picture is. So taking the time to stop and reflect, and maybe being a little more assertive than you might otherwise think you have to be to kind of understand what people are feeling and how they're reacting right now. If you've got bad news, if this means letting people go, if it means reducing hours, if it means changing the benefits or supports that folks would normally rely on, at the very least, be upfront about that and don't avoid it, because word gets out, the rumor mill starts going, and at the very least, you do allow people to have some sense of control in how they can respond to a situation when you give them the full, transparent, like this is it. This is what's going on, and this is, we're up against a wall. We're really sorry, and not just saying you're sorry, but actually using other ways to demonstrate your appreciation. So, and then finally, promoting healthy boundary setting, and that does begin with leaders. Do you expect people to check their email on the weekends, or can you give them a break? It's hard to tell other people to do that when you yourself are not following your own advice. So once again, these were some of the tools I had mentioned earlier, and just so I challenge you to go back and think, about psychological safety, and thinking about. I really did like that question back in the self-assessment checklist where it said, having a process for helping people understand kind of what their vulnerability or what their concerns might be, and using that as a conversation kind of starting point. And then kind of mapping out what the risk tolerance is for people, because you have to respect that, right? Because like I said, if you're not safe up here, you can't be safe anywhere else. And I think, without blaming people and assuming that they're just not resilient enough, they're not, let's not go down that road if we can help it. Okay. Good. So I actually have one more question here, and I guess technically it's 11:01, so we've started the Q&A, so I get to do the first question. And this could be an evaluation question. It's anonymous, but it's going to help us because my students, we have a couple nursing students with us here for the next couple months, and we're going to be hopefully developing like a 3 or 4 hour Zoom-based workshop of some kind in March, maybe middle of March. We're working out the details, but we want to hear from you, like right now. I know people are thinking, oh, I gotta go, or I'll wait for the evaluation, and there probably will be an evaluation, but right now I've got you on the spot, and I'd love to hear from you. So thanks for tuning in. And this is, you wouldn't have come today if you didn't feel already like you had a stake in this. And so you're a champion. You're somebody who does care, and you're a leader in your own right. So in terms of your own professional development and what OHC could offer, which of the following topics would you be most interested in learning more about? Okay, so once again, this is maybe a smaller group, more of like a half-day virtual workshop, breaking out into more practical kind of learnings and sharing stories and coming out with some even more practical applications. So once again, this is a limited list. If you find that this is something, there's something missing, put it in the chat, send it to Tiffany, and we'll try and cover it in the next half hour. But the first one here is communication and interpersonal skills training to promote workplace psychological health and safety. So that would be maybe a bit more around that compassion stuff I kind of touched on. I promise it wouldn't all be role playing, but that's sometimes a little bit helping people feel confident in how to talk to folks and notice when things might not be quite right. Integrating psychosocial hazard assessment approaches into your existing health and safety management systems. So this is a bit more along the lines of that hazard is a hazard course that we developed with Safe Work Manitoba and the Canadian Mental Health Association. So this is a bit more practical, but it might be actually going back and looking at some of your assessments, or even the way you do incident reporting and inspections, and working in some more psychological concepts. So similarly, understanding where psychosocial factors, stress, and ergonomics interface with MSI prevention efforts. So that's actually going to be the topic of our OHCs, and we work with Safe Work Manitoba next month, end of February. I think it's, well, Tiffany, you can correct me. I'll let Tiffany give the proper date, but end of February, we're going to have a couple hours to talk about where psychosocial factors interface with potential for musculoskeletal injuries, which is what MSIs are. And then finally, I know you're like, where's COVID and all of this? Well, the fourth one here is COVID-19 remote work challenges, strategies on how to safely return to normal operations, while also considering sector-specific concerns based on the audience composition. So we'd probably send out a survey ahead of time to understand who's coming to the table, and we kind of break out into more specifics that way. So we'll see. Maybe 4 will be the top one, but I think the other ones certainly can plug into the pandemic and are an ongoing challenge. But right now, maybe you're like, my brain is full. I'm tired of hearing from this guy. I'll pass for now. In which case, no problem. No offense on my end. So let's go ahead and I'm going to put a poll out here, and you're going to hopefully give me some results. So here we go. Which of the following topics would you be most interested in learning more about? Good. So for those of you on the recording, I think I said everything. Let's see what results we get here. And who knows? I mean, if there's like this may not be the only way we assess our community to find a topic, but at any rate, things can blend too. There can be a bit of a back and forth. It's not like it has to be one or the other. And if you thought of something else over the course of this presentation, or if you came in with kind of a hankering to learn more about something particular and I didn't cover it, or even mention it once, then please put it in the chat and make it one of your questions for the Q&A. Okay, so we are at 80%. Let's go ahead. Where did my cursor go? Here we go. Let's end the poll. And yeah, I kind of figured. I figured the 4th one might be the popular one. I'll share the results. There we go. 32%. Kind of close, actually. 32% for COVID and remote work / returning to work, and then communication skills. You know, those two really probably could be combined quite nicely now that I think about it. So that's reassuring. I think that's good. That'll help us out. All right. Thank you for hearing me drone on and on for a good 90 minutes. One quick plug for our agency, if you haven't heard of us, hopefully you have, but at any rate, we're located on 167 Sherbrooke. We provide a number of services, particularly for injured workers or even workers who don't have an injury but have concerns about potential exposure, or if they have a claim in process or they want to appeal something, they can self-refer and come and see one of our physicians. We have 2 on staff, Dr. Chase and Dr. Kraut. So please share the word. Otherwise, as a nurse, and we have social workers, and we do a lot of health promotion, outreach, education. We work with health and safety committees. We work with newcomers, helping people understand what their workers' rights are and what sorts of options they have to promote. Really a lot of prevention. So we really feel strongly about primary prevention. Okay, so that's it. Thank you. Tiffany, I think I'm passing it on to you.
So you could see on the screen, there are 2 questions from Kevin and Darius. So Jeffrey, would you mind taking a look and providing some information to the audience?
Yeah, okay, so can everyone see that? I guess they can. Kevin's asking, is there a list of aerosol generating procedures that people doing risk assessments can follow? Some guidelines or rules of thumb? Yes. And actually, Kevin, if you shoot me an email or we can post this, I think that I saw some good stuff in the checklist there that OCal has for those control bands. On the far right side, they were in red because they're the most at risk, right? I mean, the aerosolized, so to clarify for people, aerosolized generating procedures would be doing like intubation or other respiratory kinds of interventions, generally and certainly in healthcare settings, but also when sometimes emergency personnel like ambulance, they might have to intubate somebody, and even if it's for another issue, right? Like say it's a boating accident or something, and they need to do you know, something to prevent a lung collapse or something, and they have to, you know, so there's certain things they do, and that puts them at greater risk, even if the person doesn't have symptoms or anything, they could have it, right? They could have the virus. So I know there's that list. I just don't have it handy, but I can produce that for you, and I'll go back and look at what OCal has, because they're rock stars on this kind of thing too. Let's see. So the next question, Darius, as a union rep, how do I promote psychological safety when the employer disciplines, suspends, and/or fires employees for reporting injuries and illnesses? Yeah. Whew. Yeah, that's a tough one. So there's a lot of assumptions. It's hard. I mean, the other thing we do, by the way, at OHC is if somebody has a very sensitive or personal concern, or if they want answers to information that we wouldn't necessarily talk about in a large group setting because it might be personal or specific to a workplace, we would definitely keep confident what folks talk to us about. So Darius, you can also reach out to me separately, and we can have a more pointed conversation. But I'll speak generally now and say that for union reps, I mean, we still really strongly believe in the utility of a health and safety committee. And so because of that blend of 50-50, 50% worker, 50% management, like that really should be an important venue where you bring this up. And you say, look, like we want to create a culture of a no blame culture. And this is the root of what a psychologically safe workplace is. I mean, that's the fact that they're firing people for reporting injuries and that's like shooting yourself in the foot. Like it's just dumb. It's not good. Like you're going to miss so much if you don't create a safe space for people to report. So, and I don't know if Darius, you're coming from healthcare, but healthcare has, I feel like maybe sometimes more parameters in place now. They've come a long way in understanding where medication errors can be safely and systematically reviewed without, basically pulling the rug out from people, assuming a systematic or non-personal factor that led to the error and not that the person was automatically lazy, negligent, or immoral, or whatever, right? So coming from a place of we're going to think it's an organizational or system problem first before we think about it from an individual standpoint. So the fact that they're firing people like that just tells me a lot about value in their workforce. Like they don't trust their workforce to do more. So that's not really. That's a really big question, and I think it needs to be tailored specifically to whatever your situation is, and that's exactly the kind of thing we can offer some more specific support around. So please follow up with me. I think my email address is out there somewhere. I hope so. Particular employer I'm thinking of makes earth moving equipment. Oh. Makes earth moving equipment. Okay. Okay. So you know what? That kind of makes it a little bit easier in the sense that that's like construction and manufacturing. And honestly, like that's something that I think even these employer-funded safety programs, right? They exist in part to kind of provide a space for employers to, they help fund these associations. And then the idea is that they have training and outreach coming from that kind of peer-driven place. So I know that's not kind of where the unions operate, but that is kind of one pressure point where it's like, okay, you've probably heard of core certification, which is what the construction industry has to have. And I'm 99.9% sure they've got safe incident reporting practices in there, right? So once again, you can take a look at kind of what the industry standards are for that. Like I said, healthcare has a lot of really good kind of, the hospitals, if that happened in a hospital, the accreditation folks, people who, stamp and give the authority for funding and stuff would be like, No. You can't do that. You have to like have a fair way of going through incident reporting. So I would recommend, yeah, just get in touch with me later if you want to talk more specifics. But every industry should have, at least in Manitoba, the idea is to move towards employer industry representation, and incident reporting and psychological safety continue to be, well, I should say the incident reporting part of it is high on their priority list. The psychological piece, I think, is kind of lagging, but I think we can help inform them on that too. Anyway, okay, so next person, in the event that an employee does not have enough banked sick days and they fall sick with COVID, would they still be paid or put on non-pay sick leave? Okay, that's a very good question. Once again, it does depend on kind of what the employer has set up. Usually, if you've fallen sick with COVID and that's been documented and you have like a test result that says that, or if you've been roped up into contact tracing by public health, you should be eligible for COVID assistance, even from the federal government. I apologize, I'm not up on the specifics of like EI, but I would explore that. And your employer should have that readily available. If they don't, then that's definitely a gap on their end. So if you're in healthcare, I can certainly help direct you around that as well. Occupational, they have some guidance on that as well. But yeah, no, you would get that there would be some support on that, I think. Certainly around EI at least. Okay, anyone else?
No, it's not on my list. Would you like to check, the chat box have any more comments?
Oh, I see.
I got cover everything, the questions.
Okay. I see some conversation here about what Darius was saying. Yeah, I mean, the good thing about these kinds of presentations is, it gets kind of turns over some rocks, some stones, and it might help people think like, oh, shoot, I didn't think about that, or, oh, I want to follow up. And doing that in 90 minutes or 2 hours is pretty near impossible. It's because everyone has specific concerns and specific needs, right? So if Darius, if you have other information needs, or if you have questions that myself or someone else on our staff could assist you with, then just shoot us an email and we can help you with that. A lot of people saying thanks, so that's nice. Okay. Yeah, I don't get as many questions. I don't know. I don't think it's any reflection on necessarily on my comprehensive covering everything. It's probably more like deer in the headlights, like, oh my gosh, this is a lot to think about as I lose my voice. But we encourage, I don't always get follow-ups from these things, but I'm more than welcome, more than willing to help. My February is a bit more open now. And I should say we also do presentations and outreach in specific workplaces. We like to do that with health and safety committees coming in, and our idea too is to kind of build the capacity of committees to do, for example, their own ergonomic assessments, their own kind of understanding their own work environment that way. It is trickier with psychological assessments or psychosocial because legislation just hasn't caught up with what some of the other researched ideas have brought us to. But that's not to say that employers can't go a little further and demonstrate kind of some more progressive thinking about some of these ideas. So good. All right. Guess maybe I could have shown that video, although it's all right. I hope OCAV's all right with that. I told them I'd show it, but it was interesting. It's good to see evidence that because we keep talking about how there's like got to be like direct correlation between what people experience psychologically and what they experience, you know, physically. And I think the more and more of that gets kind of brought about to emphasize, the better it is for everyone. It just brings it to our attention. Yeah. So Tiffany, do you want to tell everyone what the dates are for RSI Day, since we have a few?
Yes. The Occupational Health Center organizing an annual repetitive strain injury awareness day event. This year will be falling to Friday, February 26th. The whole morning, probably from 9 a.m. to 12 noon, we're going to have a series of presentation. 4 speakers going to give us a presentation during the whole morning. So the promotion material probably will be sending out next Monday and next week. Then all of you will going to get the information. This year we will be promoting the psychosocial risk factor related, the link with the musculoskeletal injuries. So hopefully you will be able to join us.
Yeah, and we're all experimenting with new ways of doing this. So I think it's going to be a series of shorter kind of, I don't want to say fast-paced, but like keeping it interesting by having kind of shorter little presentations and maybe some breakouts. I'm not quite sure, but yeah, so join us. And then thanks again for your feedback on doing something in March. I kind of figured remote work was going to continue to be kind of this elephant in the room. So we'll keep chipping away at it and see where we go. Okay, well, I guess if we don't have any more questions, I still see 37 people are still listening, so that's good. Or at least logged in.
Great. Thank you all of you for joining the webinar this morning. So you all take care and stay well, stay safe. Bye.
Take care, everyone. Bye-bye.